Measles outbreak in South Carolina has now spread to at least 789 people. The surge in cases comes as the United States edges closer to losing its measles elimination status, which could happen as soon as this fall. That's because measles cases in 2025 hit the highest total in more than 30 years, with more than 2,200 cases reported across 45 states. Nearly all cases were among people who were unvaccinated or with unknown vaccination status. Let's bring in MS Now medical analyst Dr. Vin Gupta. Dr. Gupta, thanks for joining us. What do you make of, what do you think the reason is for this current status that especially this state is in?
Good morning, Mika. We're already at 416 cases, we think, of those that are tested. So often there's underdiagnosis, but 416 at least cases already in 2026. And we know that this is because, as you pointed out in the tee-up, an unvaccinated status amongst children. What we've seen now, we have a clearer sense of the country and vulnerability to measles. Mika, we're seeing some zip codes in the United States having measles vaccine uptake rate of about 60%, which is just fodder for an outbreak that can get out of control, which is what we're seeing in South Carolina. This is impacting not just children, but the extremes of ages, those that are older, pre-existing conditions. So there's a lot of baked-in vulnerability right now across the U.S.
Dr. Gupta, obviously part of what's driving this, as you say, is under-vaccination in South Carolina and other places, by the way, across the country. There's been a lot of conspiracy theories now that have moved up to the top of government leadership, people hearing that, people they trust saying, be careful with these vaccines. What can you tell parents watching today about the safety of a measles vaccine specifically, as it has been for generations now?
No, Willie, I know you and I have been chatting about this as we've been chatting with the broader team about this specific question. Is there anything new that parents should be worried about when it comes to the safety or efficacy of these vaccines? And the answer is, even though we have had to talk about it more for reasons that have nothing to do with medicine or new science, the truth is that there is no changes at all to safety guidance. There is no evidence saying that these are any less effective. These measles vaccines are incredibly effective at reducing transmission, at preventing severe illness. They are essentially the gold standard when it comes to preventing an infectious disease, Willie. So no new changes. I will say also for parents, those that live in places, now many more places across the country have this vulnerability. You may be one of our audience members right now, might be in one of those zip codes. What should you be on the lookout for? And this is where it's difficult because there's a lot of flu going around across the country. Early signs of measles, frankly, are not that different from flu or any other viral illness, for example, that might mimic the early symptoms of measles, but it's cough, runny nose, and pink eye can actually be the early signs of measles, which is confusing, and that can lead to that classic rash a few days later. So be on the lookout. Speak to your child's pediatrician if you're worried.
Dr. Gupta, you've also been looking at tobacco use in this country and specifically the policy changes made by the Trump administration that you say will significantly hinder progress in combating tobacco-related mortality rates. Tell us about it, if you could explain.
Yeah, the American Lung Association every year puts out, Mika, their global tobacco report, what's happening across the world. And, it's almost, we're talking about measles, so harkening back to the past, smoking is still the second leading risk factor for death in the United States and worldwide. So a lot of people still do it. What has the Trump administration done in their first year in office? They've eliminated the CDC's Office on Smoking and Health. What does that office do? It actually provided one of the most successful public health media campaigns the United States has ever seen. The tips from former smokers that helped 1 million people plus quit smoking. Still a major problem here. FDA under Trump is actually making it easier for young people to get access on vaping fluid, different types of menthol vapes that they know can then unfortunately addict youth to smoke and then ultimately be a gateway to cigarettes. And so it's, and unfortunately, they made it harder for people to quit, and they made it easier for young people to actually start on their path to cigarette smoking. So the worry here is, will prior progress continue into the future, Mika?
One more item for you here, Dr. Gupta. The United States this month formally withdrew its membership from the World Health Organization after decades of participation. So what are the consequences of that move? Why is that significant for people who don't quite understand what the WHO does and why it's important that the United States is involved?
You know, first of all, I'll start by saying the WHO and their leadership widely acknowledge they need reform. And so no one's saying that the WHO doesn't need to be changed and need to look really closely at what went wrong during COVID and to reform. The U.S. pulling out of the WHO doesn't help at all with that. And if we don't have a WHO that's functioning, they monitor infectious disease outbreaks, those that start as an epidemic somewhere in the world and can translate into a pandemic without appropriate measures in place. We're not a part of that anymore. So data sharing, what's happening in the world and how can we, hospitals and providers across the country, be prepared and care for our patients appropriately, care for American families appropriately. We no longer have that intelligence because we're not a part of this convening body. There isn't a WHO. We need something in its place. And there's no plan B here that the administration has offered. California, under Governor Newsom, has decided to join as an observer, which I think is a template for other states to follow suit. What does that mean? That they'll have access really to this data. Data here is critical. What is happening in the world with flu, other infectious diseases? How can we prepare? If states will follow that lead, that's one approach, but it does not in any way substitute for the lack of federal government involvement. And frankly, this weakens the WHO. We were the greatest contributor to its resources, so it's not going to be as effective at doing its core job here, which is protecting global citizens and, of course, every American family. I think that's what's being missed.
MS Now medical analyst Dr. Vin Gupta, we always appreciate your coming on the show and joining us. Thank you for coming on this morning.